General anesthesia. General anesthesia is most commonly used for major operations such as abdominal, heart surgeries, and many types of surgical procedures to treat cancer. It is a drug-induced loss of consciousness during which you cannot be easily awakened even by painful stimulation. Many of these surgeries are life-saving or life-changing and would not be possible without general anesthesia. Before your procedure, an IV line will be placed in a vein in your arm using a small tube called a cannula. The IV will deliver fluid and medication directly into your bloodstream. You may receive some medication to help you relax. You will be placed on the operating table and made as comfortable as possible. Sticky pads will be placed on your chest to check your heart rate, and a clip will be put on your finger to check your body's oxygen levels. These devices allow the anesthesia specialist to closely monitor your vital signs before, during, and after your procedure. You will begin receiving general anesthesia by either breathing anesthetic gases through the mask or through IV injection, which will cause you to fall asleep. Once you are asleep, you will be given a mixture of oxygen and anesthetic gases either through your mask or through a special tube inserted through your mouth and into your throat to help you breathe. The tube is attached to a respirator which will help you breathe while delivering the gases to your lungs. During surgery or the procedure, the physician anesthesiologist will monitor your heart rate, blood pressure, breathing, and other vital signs to make sure they are normal and steady while you remain unconscious and free of pain. Once surgery is complete, your anesthesiologist will reverse the medication and be with you as you return to consciousness, continually monitoring your breathing, circulation, and oxygen levels. Some patients feel fine as they wake up. Others experience symptoms such as nausea, vomiting, or chills. Your anesthesiologist will help you manage these symptoms. You may also feel pain and discomfort as the effects of general anesthesia wear off. Your anesthesiologist will advise you to manage the pain during your recovery in the hospital and at home. It may take a day or two for the anesthesia medication to completely leave your system, so you may be sleepy and your reflexes and judgment will be affected. Regional anesthesia. If you are having certain operations such as pelvic, hip, or leg surgery, you may be able to avoid general anesthesia by having your operation under spinal or epidural anesthesia instead. Spinal and epidural anesthesia are also often used during childbirth. Both spinal and epidural anesthesia involve injecting medications near the spinal cord. This makes you numb from the level of your chest down to your feet. Advantages of spinal and epidural anesthesia include the ability to be awake during the operation and to avoid the risks associated with general anesthesia because spinal and epidural anesthesia rarely cause decreases in blood pressure and other changes that might require rapid treatment. You'll have an intravenous line in place so that fluids and medicines can be quickly delivered. You will also be connected to various monitors to keep track of your blood pressure, pulse, and the oxygen content of your blood. You will be positioned either sitting with your body slumped forward, chin on your chest, shoulders down and bottom curled under, or lying on your side with your knees curled up towards your chest. Prior to receiving spinal or epidural anesthesia, the anesthetist will use an antiseptic solution to clean the area of your back where the medicine is injected. To decrease pain from the needle stick, he or she may instill a local anesthetic directly over the spot where the spinal or epidural needle will be inserted. Spinal anesthesia involves a single injection of medication into the sac of fluid that surrounds your spinal cord. To reach this fluid sac, the anesthetist will pass a needle through your skin between the vertebral bones and finally through spinal ligaments and the dura, which is the protective membrane around your spinal cord. Spinal anesthesia begins working almost immediately after the injection is completed. Your anesthesiologist will need to check the level and quality of the block. You will be asked to lift your legs off the bed and they should feel very heavy or you may not be able to move them at all. Your anesthesiologist may also check the block using a pinprick or gentle touch. Once the anesthesiologist is happy that your spinal anesthetic is ready, your operation can start. After spinal anesthesia, you will be kept on bed with your head flat for several hours. Regional anesthesia is very safe and doesn't involve the potential complications and side effects that can happen with sedation and general anesthesia. But it does carry some risks, and it's important that it be provided and monitored by your anesthesiologist.